Schizophrenia. Schizophrenia is a serious mental health condition that affects how people think, feel, and behave. It may result in a mix of hallucinations, delusions, and disorganized thinking and behavior. Schizophrenia symptoms are described in terms of positive, negative, and cognitive symptoms. Positive, pathologic excesses. Positive symptoms are those symptoms that are not normally experienced but are present in people during a psychotic episode in schizophrenia, including hallucinations, false sensory perception in the absence of stimuli, for example, hearing voices, delusions, false belief despite evidence to the contrary, for example, the neighbors are aliens, disorganized incoherent speech, disorganized agitated behavior, negative pathologic deficits. Negative symptoms are deficits of normal emotional responses or of other thought processes. The 5 recognized domains of negative symptoms are apathy, lack of motivation, social withdrawal, flat affect, emotional flattening monotone speech, poverty lack of speech, anhedonia, inability to experience pleasure, cognitive symptoms. An estimated 70% of those with schizophrenia have cognitive deficits, and these are most pronounced in early onset and late onset illness. Cognitive symptoms are often evident long before the onset of illness in the prodromal stage and may be present in childhood or early adolescence. Schizophrenia presents with a variety of cognitive, behavioral, and emotional disturbances and typically has an onset in early adulthood. Peak age of onset: men in early 20s, women in late 20s. Schizophrenia has a gradual onset, but occasionally a precipitating stressor unmasks the disorder, such as in a patient with symptoms after the death of his father. The diagnosis of schizophrenia is made with continuous signs of disturbance for at least 6 months, including at least 1 month of more than 2 of the following active symptoms, with at least 1 from the first 3. Delusions, for example, fixation on a date and time, thinking that it has special meaning. Hallucinations, disorganized speech. For example, frequent change of topics, random remarks. Disorganized catatonic behavior, for example, bizarre drawings. Negative symptoms, for example, apathy, flat affect, social withdrawal, lack of speech, anhedonia. Although positive symptoms, for example, delusions, hallucinations are characteristic in schizophrenia, some patients demonstrate largely negative symptoms with increasing social withdrawal, for example, not responding to friends, apathy, for example, not completing homework assignments, and affective blunting. The primary treatment of schizophrenia is the use of antipsychotic medications, for example, risperidone, olanzapine. However, these drugs are more effective at managing positive symptoms. Negative symptoms are typically refractory to intervention. Fixation on date and time as having special meaning is a referential delusion, that is, a belief that cues from the environment are individualized messages. Patients with delusional disorders typically do not have referential delusions, negative symptoms, or disorganized speech. Response to a significant loss may include withdrawal, apathy, flat affect, or preoccupation with memories of the deceased. However, normal bereavement does not cause disorganized speech, disorganized behavior, or delusions. Behaviors related to obsessive-compulsive disorder, such as ritualistic washing or chewing food a certain number of times, can appear bizarre. However, bizarre, indecipherable speech, negative symptoms, and referential delusions are not associated with obsessive-compulsive disorder. Post-traumatic stress disorder involves psychological distress following a traumatic event. It can present with distress-related disturbances resembling hallucinations and/or mood alterations with anhedonia and negative emotionality. However, disorganized, incoherent speech and thought are not seen in post-traumatic stress disorder. Schizophrenia is diagnosed in patients with signs of disturbance for 6 months, including at least 1 month of 2 of the following active symptoms, with at least 1 from the first 3. Delusions, hallucinations, disorganized speech, disorganized catatonic behavior, and negative symptoms.